We'll give it a couple minutes for everyone to get into the space. Good morning. Hi, everyone. So good to see all these names. Hi, everyone. All right, I think we're slowing down with people entering, and I want to make sure we have as much time as possible for this fantastic beachside chat. So I'll get us going, and we may have more join as we go along. So welcome everyone to our UCLA Rapid, Rigorous, Relevant Implementation Science Hub Beachside chat. Sorry, that was a mouthful. We are so excited for today's Beachside chat. I'm Alison Hamilton, one of your hosts, along with Dr. Chunqing Lin. And we love doing the Beachside chats. For anyone who has not attended a beachside chat previously, welcome. These are really meant to be informal conversations about topics of interest in implementation science with leading experts in the respective fields. We have done many. They're available on our YouTube playlist, which we'll show you at the end of today's session. Just so you have a sense of how things will go, we're going to do a couple poll questions, introduce our panelists. They're going to share some of their work briefly with us, and then we're going to come out of slideshow mode and have a chat. We will be asking you to put your questions and comments in the Q&A portion of Zoom. That's what works best for us with these beachside chats. So we'll ask you, you can feel free to put your questions in Q&A at any point. And of course, if you have any technical issues, you can put those comments in the Q&A as well. I do want to mention that everything that we share today is from our own perspectives. Anything that we share does not represent the views of the government, doesn't represent the views of NIH or any other funders. We're here sharing our perspectives and looking forward to hearing your questions and comments as well. So I think I have covered everything from an introductory perspective. Chunqing, did I miss anything?
No, you covered it just
Okay,
well. Thank you.
great. Thank you. Next slide, please. And we do want to thank NIAID for funding our hub. This is part of a network of hubs across the country that all address HIV-related implementation science. So our topic today, very exciting, is the intersection of policy and implementation in HIV research and practice. Very, very timely topic, and we're really excited to have these two wonderful panelists and colleagues with us, Dr. Ayako Miyashita Ochoa and Dr. Naina Harawa, both of whom are at UCLA. They'll do a little bit more of an introduction when they start their portions. We're super honored to have both of them with us today, given their extensive policy backgrounds and really amazing work in this space. So thank you both so much for being willing to do this with us. We really appreciate it. What we'd like to do is just get a feel for the folks who are with us today. So we're going to do a couple poll questions before we get started with our content. So Enrique, would you mind launching those for us? We can go to the next slide, which is just about your primary affiliation. So if you can just let us know where you're coming from today, that would be super interesting for us. How are we doing on results, Enrique? Okay, great. So mostly academic, but we have a nice representation from healthcare systems and organizations and community-based organizations, folks from every group here. So that's excellent. Thank you all so much. We're really glad that the Beachside chats are reaching a wide range of individuals. So thank you again for taking time to be here. And we can go to our next poll question for the next slide, which is about your familiarity with policy implementation scientists. So if you can just let us know where you would locate yourself. Right, and how are we doing with those results? Okay, so mostly in the somewhat and vaguely area. Couple of experts, couple of pretty familiar, and some who are not familiar at all. So that works really well too. Always great to have a range of knowledge bases for our different topics. So thank you so much for answering that poll as well. Okay, next slide, please. So, given what we thought might be the case, which is that there might be a mix of familiarity with policy, implementation research, we want to make sure to do some stage setting. Can't think of two people who are better suited to do that than our panelists today. So, they're going to walk us through a little bit of content on how do we even think about policy, as well as examples, really brief examples from their own work that will help to launch our discussion today. So first, I'm going to turn it over to Ayako. And if you don't mind doing a brief introduction, I think that would be of great interest for our audience, Ayako. Thank you.
Sure. Good morning, everyone. Ayako Miyashita, Ochoa, she, her pronouns. I'm at UCLA at the Luskin School of Public Affairs, and I'm really pleased to be here with you today.
Thank you.
Hi, I'm Nina Harawa in the Department of Medicine at UCLA. I'm also in the Fielding School of Public Health and at Charles R. Drew University. And I think I need to turn it back to Echo, who's going to give us an introduction into policy.
Thank you, Nina.
So,
Can we move to the
you
next
can let
slide?
Enrique know when to
That would be
advance.
great. Yes, let's move in. So, I just wanted to acknowledge today that we're in a particular historical moment, and what I'm presenting to you is a theoretical framework. So, I want to just put out there, personally, sometimes I find that there's a disconnect between what happens in theory and what happens in reality. And so, with that, the reason why I'm going to cover some of these basics for us today is because I really want to be able to drill down into thinking through where science fits in our law and policy process. And so here, I just want to share with you the three branches of government. I know we're going back to like civics class here, but really important to know. We have three branches of government, and that each of these branches of government have specific roles to play. And I think that what's important to know here is that each of these sort of branches offers opportunities for where science might fit. And I want to say that I know there are some really savvy people on this particular beachside chat. So I want to frame this from the perspective that, you know, as scientists, our job is to generate, right, research. And I think of research as essentially telling a story. And if you want your story to be told, I think that some of the most best situated folks in the mix to go and tell that story are our policy advocates, people who are trying to improve systems of care to address HIV in more effective manner. So this is my shout out to you all that do that heavy lifting, and many times do that heavy lifting for us. Next slide. So I generally give this presentation to all my students and sometimes to my colleagues as well to talk about essentially how our government is structured, right? We live in a representative democracy. And the system of federalism that indicates that we have different layers of government. And so, therefore, we have different sources of law and policy. And so, you'll see under each federal, state, local, there are laws, there are regulations, and there's a certain amount of case law that comes out of the judicial branch that interprets those laws. Additionally, there are regulations, guidance, and policies, some of which are not necessarily right enforceable, but really helpful in terms of implementing programs. Next slide. I don't want to discount in any way, shape, or form by talking about those three levels to essentially downgrade what happens in practice, right? So those of you that are practitioners, particularly working in local programs or working in organizations, the rules that you create and establish at the organizational level or at the local level in the public health, space, that those may have a great impact in the way in which people access care. And so I uplift that in part because when we talk about the terms law and policy, I think there's often a mistake made and an assumption made that the only law, right, that we abide by is law that is this is the Schoolhouse Rock version, right? Language that is right developed and written by the legislature and then signed by the executive and implemented by the executive, right? What we call statutes or law. And I think that that is a mistake, in part because there's a real distinction here, sort of on paper about what is law versus what is policy. You can see some basic definitions here on your screen. But when it comes down to it, what is the lived experience of the person on the receiving end of care, right? How do laws and policies shape their experiences? Well, they're very much a result of and driven by both law and policy. And so I'll give you an example. If we look at the Affordable Care Act, that was a piece of federal legislation, right? Written, drafted, passed through the legislature, signed by the executive. We look at how the ACA is then implemented. We see that there are a variety of cases that have come up challenging certain pieces of the ACA, and therefore case law, right? What is interpreted by the judicial branch becomes a part of how we understand the law to be. But when it comes to the implementation of the law, something that's, right, the job of the executive branch, they create the little rules, if you will. Those little rules, I'll give you an example. Section 1557, the non-discrimination provision of the ACA, can have a really big impact, right? So I think that while we often bundle the terms law and policy together, and while on paper there are these neat ways in which you might separate out each thing, in reality, if you want to think about how they shape our current conditions, it gives us some insight into where we might go with our research. Next slide. I want to give you sort of an example of a project that I worked on so that you can get a sense of how I've integrated policy in the process of creating and implementing research, right? So the California Pharmacist Study is a project funded by the California HIV/AIDS Research Program. Shout out to our funders, right? In collaboration with partners at UC Berkeley, folks at the Northern California HIV/AIDS Policy Research Center. Also, right, done in collaboration with folks that are on the ground. So pharmacists who are part of both CSHP and the California Pharmacists Association, two sort of bodies of advocates, if you will, that really know what the law is and how it applies to pharmacists. So the first step in what we did with this project is we recognized that there was permissive state law that allows for pharmacists to prescribe PrEP. And it was first in the nation when this law was passed here in the state of California. And what we really quickly realized is that, here, what was the current law at the time, pharmacists were authorized to prescribe for 60 days. They have to complete a training, but essentially they could do this initial sort of dispensation, right? And education and HIV testing, and they were given the permission to do this. But somewhere in there, we figured out, wow, we don't know how this is actually being implemented. And I think this is the right sort of the beauty of implementation science. Like we need to know how this particular innovative intervention that has now been approved under the law is actually being implemented. And what we found out was that through this particular project, there are significant barriers, right, to implementing pharmacy-based PrEP, that there's still things that we needed to explore in terms of facilitators to getting more pharmacies and pharmacists doing this work, and that there's still unknowns. And so our research enabled us to sort of be able to identify what those things were in such a way that when advocates sort of came back to the table to look at Senate Bill 159, they were able to then use the data we generated from that study to inform new legislation. And that is what I put here as future law is actually our current law, which is SB 339. And under that law, we moved to sort of adjust some of the pieces of the current law at the time that were acting as barriers to implementation. Now, those of you that work with pharmacies, you know that things have changed significantly since even the passage of 339. I won't get into the details of that, but I think what's important to know is there are a couple of steps that, we took to make sure that we were delivering policy relevant findings. One of them is knowing what the law is, knowing who is working on addressing that law and its implementation. In this case, it was both the author's office at the legislature as well as advocates that were working to increase access to HIV PrEP. And then knowing how to then share those results so that it could be informative to future legislation. And that's really just the story of one project and how we were able to do this.
So I think I get to talk now about another example. Enrique, if you don't mind going on to the next slide. Okay,
I guess there was one more slide. So
okay.
here's my apologies, Dinah. Here's where I think as researchers, we have to figure out, so where do we deploy our research findings? And I think we're actually going to talk about this a little bit more during the Q&A, but this is just a really brief example of where across these different spaces and places research can be deployed. And so, as I said earlier, at the organizational level, right, or the different 3 branches, or to people, to frontline workers, as well as affected communities, that deploying research findings is incredibly important, right, to inform law and policy. So that's my slide there, Nina. Thank you.
Sorry about that. All right, thank you. I'm going to kind of take it from there and talk about maybe another story specific to another initiative. And this has to do with CalAIM. So CalAIM is, as many of you probably know, is an initiative under Medi-Cal, which is California's Medicaid program. It stands for California Advancing and Innovating Medi-Cal, and it's a multi-year initiative currently being run by our Department of Healthcare Services. The goals of CalAIM are to enhance care coordination and improve the quality of care that Medi-Cal recipients receive, and it involves a lot of different components that are intended to make broad delivery system, program, and payment reforms. So as you know, Medicaid is run by the states, but with both federal and state funds. So it's impacted, going back to what Ayako just spoke about, by both federal and state laws. Waivers from CMS are one of the main mechanisms for expanding and changing how Medi-Cal operates within states. And California has used waivers over the years to develop many different programs, including the Whole Person Care and Health Homes projects, which were part of the foundation for the current CalAIM waiver. CalAIM first began in January 2022, but various components are still being rolled out, and it has several initiatives. I'm going to focus in on one, and you'll see a little bit about its connection to HIV. If we go to the next slide. So part of the CalAIM demonstration project is the Justice Involved Initiative. David Zingmond and Catherine Kahn at UCLA lead the evaluation for 5 of the CalAIM initiatives, including the Justice Involved Initiative. I'm part of the team at RAND in UCLA, and you see the names here. We're led by Melissa Labriola, and we're the team that's specifically evaluating the justice-involved initiatives. And that's of major importance to HIV because the prevalence of HIV in prisons and jails is 2 to 3 times that of the general population. And people with HIV often struggle to remain virally suppressed following release from jail or prison. And we can imagine that it would also have impacts on people who were already on PrEP or considering PrEP prior to entering custody. So if we could go to the next slide, I'll just speak a little bit more about CalAIM and how I see it relating to some of these principles of implementation science. So the CalAIM initiative, and which is just the Justice Involved Initiative, has several components that start pre-release but then follow into the reentry period. And they're designed to support Justice Involved initiatives by providing key services pre-release, including enrolling them in Medi-Cal coverage, which prior to both enrolling them in Medi-Cal coverage and enabling Medi-Cal to cover services that they receive pre-release. There's something called the Medicaid exclusion, which basically excludes healthcare services received in jail or prison to be covered by Medicaid, but this waives that in the 90 days pre-release. But then other components involve connecting them with behavioral health services, social services, and other providers that then support reentry. So this initiative involves funding and support both for correctional facilities and providers and for reentry and transition providers in the community. So I would describe policy in this example, this Justice Involved initiative, using the PERTLS framework that some of you are familiar with and we'll also discuss shortly, as studying something that is being implemented, but is also a context to understand. In other words, we've had to understand in our work in this evaluation and are constantly learning much more about the context of healthcare delivery and payment in both jails and prisons, which both differ from one another, but also they differ drastically from how it works in the outside world. So that's the context. But further, we've also had to understand how shifts in policy and practice, in other words, how things worked prior to CalAIM for each of the parties involved, and then what the implications are of becoming Medi-Cal providers for the correctional facility and the non-medical community agencies that have become part of CalAIM, because that's a pretty dramatic shift for them. So these intersetting capacities, processes, and cultures were all part of what we've tried to understand and have all been affected by CalAIM, and the implementation of CalAIM has been affected by those things as well. So if we could go to the next slide. It's been interesting for me in looking at how CalAIM initiative and the Justice Initiative is being implemented, is that in preparing for CalAIM, DHCS used several implementation science type tools to facilitate effective rollout. These include the use of readiness assessments, like the ones you can see on the slide, as well as the engagement of an advisory group of key stakeholders, including those with lived experience, to advise the planning process. Of course, our evaluation of CalAIM also involves common implementation science approaches, such as qualitative data collection, analysis of program data, and review of program-related documents. One of the major challenges we experience is not unlike that we're hearing from stakeholder interviews in the process of the evaluation, namely getting agreements and processes set up to share program data to enable the linkages shown on the last slide. If we could just switch back for a minute, has been a major challenge. As you can imagine, CalAIM involves sharing data with a lot of parties that do not normally work together and may lack the systems and the person power needed for the ongoing data sharing that really must happen in real time to be effective. And that both HIPAA and technical aspects of this are ones that are critical to being able to implement these policies and many others, but then there are also challenges that we run into in the course of doing implementation science research. And then I also wanted to point out that in one of my many other hats, I'm working with two reentry providers on a NIDA-funded study, and two of these providers are in Riverside County, and one of them is a Calais ECM provider. And so they're both part of the Justice Involved initiative, but they're also providing services to other people, other Medi-Cal beneficiaries who are receiving enhanced care management surveys. If I, as a researcher trying to implement this intervention study, was not aware of CalAIM, my study instruments and even might potentially miss important factors influencing both our implementing partners who are implementing this intervention, as well as the study population. So we might not ask the right questions, or we might misinterpret our findings because if we were ignoring or not understanding that context. So I'm hoping that these examples are helpful in thinking about how implementation science can both address and be affected by policy. And I
Amazing.
will turn it over.
Thank you so much, Ayako and Nina. Those were super helpful, and I learned so much just from listening to you and have many, many thoughts going through my head. Can you just switch back to that slide for 1 minute, Enrique? I'm sorry, that might be different than what we were thinking of doing, but just wanted to share this really briefly, and we can come back to it at the end too. So Nina, you had mentioned this Pirtle paper, and I just wanted to share this with folks in the audience. If you haven't taken a look at this, we really recommend it because it's so practical in terms of giving us 4 ways of thinking about policy and implementation science by Jonathan Pirtle and colleagues. And Jonathan's been tremendous leader in this space. And I think this really may help us frame even our discussion in our remaining time, thinking about policy as something that's being adopted, as a context to understand, as a strategy to use, and as something to implement. And of course, these are not mutually exclusive, and we might be paying attention to some or all of these in any given project. So really, really useful way of getting into this area if it's not as familiar to you. And so recommend that and feel that it's such a great way of thinking about, these examples that you have shared with us. And so we just wanted to share that with all of you. Now we can come out of the slides for a little bit, maybe about 20 minutes or so, and have some discussion. So again, thank you so much. Those were fantastic examples. And I think 2 things that really struck me, well, many things struck me, but one thing that struck me was about the issue of that you were highlighting, especially Ayako, about sharing stories. And I think that's such a big topic that we often think about in implementation science is how do we effectively communicate what we learn to our constituents, and our constituents, as you have both shared, are so wide ranging. So many different people are involved in these processes. And as you were talking about, Nina, these are not often people, or not necessarily people, who would necessarily connect with one another. And so even thinking about ways of sharing for such a multitude of different audiences, and if you could share thoughts about, or even, experiences with, how have you gone about kind of framing your results for different audiences, and have you found that there are ways of sharing results and stories that are more or less effective? I think any kind of tips and ideas, approaches that you've had along these lines would be, I'm guessing, super helpful for me, certainly, and for our audience more broadly.
I can go first on this one. I will say you're absolutely right. We have different ways in which we want to communicate these stories, right? I think that the legislature, for example, they have multiple audiences as well. And during the legislative process, they actually want first person stories. They want people who are impacted and affected to come up to Sacramento, right? To share their stories, to convince other people who may be on the fence about a particular policy issue. to hear that story and to be affected by it and to think about that person and that individual in light of the particular proposal. And so I think a lot about how while research is really collecting a large number of stories and trying to, right, reduce them in some way, shape, or form into sort of cognizable messages, I think that that's one thing to sort of always remember, that don't forget the individual story, don't forget the individual that can tell that story. And that person really should be, or those persons, right, those stories, those individuals really should be part of helping to shape what questions you ask in the first place. Because at the end of the day, if you come up with a research project and you ask questions that truly are not relevant to the communities that you are trying to represent through your research, then it's not useful. Here's another way I think about it. Authors' offices, electeds, people who are really needing particular data points to be able to, again, right, advocate for improving systems of care, for example. They need the story told oftentimes in numbers. Numbers are the most convincing, right? For some folks, that quantitative data is what's going to get somebody off the fence, right? So it's really important that if you're thinking about answering a particular question, could you put a number to that? And maybe that's the way you communicate with an author's office on an issue. I think, right, research belongs to the people. And so when you're thinking about how you're going to share results back to the communities that are part of the research, right, people who are centered in the research, you should most definitely be thinking about what are those key takeaways. How are you going to frame those in a way that's digestible? And this is where I think even policy briefs don't cut it. I think we're getting closer and closer as we talk about infographics, as we talk about short form videos, as we talk about images. But really, it comes down to the nitty gritty of dissemination. And I do feel like the research community is really starting to listen to that, to listen to the call for those kinds of tools. Because, how else are we going to come back to the folks that we are, indebted to? We ask them to share their stories with us, and we are here to listen. And so, how do we come back with that? So those are some of the ways in which I would think about how we frame sort of this sort of right, returning the data to where they belong and communicating that to different constituents, if you will.
Thank you so much. You're getting lots of love from the audience on those responses. Thank you. Naina, what thoughts do you have about that?
I mean, I think Ayako articulated that so well. I just wanted to plug that CHRP and the policy centers have a fabulous website that we can put on the chat where you can see examples of a lot of this work.
Right.
The UCLA CTSI also has some resources on like writing policy briefs that people might find useful. And then I think, and maybe the only thing I would add is I think forums, a lot of those things that you talk about are asynchronous, which are important for scale. But I also feel like when there can be forums where people can have this type of interactions that we're having today, that is really important because we never know if people are getting what we're intending to come across, or there may be something specific to their context that they really want to help understand the implications for. And hopefully in dialogue, we can address those things.
Nice. Chunqing, what are you thinking about?
Yes, yeah.
Yeah.
Thank you. I just wanna echo the Perdo article that kind of like articulate for ways to conceptualize policy, which is so helpful. So yeah, so we covered the first box, policy making as something to adopt, and then we collect some question from the audience. There's some question about like how do we understand policy as a context to implement evidence-based intervention, the thing, right? So, can you talk about how implementation scientists account for policy and other contextual factors in the implementation science research?
I mean, I think sort of the specific name or the way we describe it might depend on the frameworks that people are using, but I think of this as, being keys to that outer setting and, ideally going in with some knowledge so that you can ask the right questions, but then having those partners and those stakeholders who can help elucidate what some of the other ones may be that maybe we didn't even think to ask about or attend to until we learn from them of how much they were shaping day-to-day work. And so what's nice about the Pirtle article is that it's very short, but it gives, depending on those four aspects of that framework, it gives several references that you can then go and look up that are kind of specific to that. And so I would really encourage people to look, like bookmark that article, and then it will give you the map to wherever else you may want to go, including more specific answers to that question.
Can I also add like a really simple thing? Phone a friend, y'all. There's so many people on this call already that are experts that know what is happening on the ground, that can tell you what those conditions look like, that include people with lived experience. And they're the ones that can really drill down and tell you what you should be asking about. So I see in the Q&A a question about Medi-Cal and what we think is going to happen. I think we already have a preview of what's going to happen and what is happening and what will be the reality for folks, especially here in California. I think we know that the work requirements and everything that comes along with annual recertification is going to create barriers that will not, right? That will lead to reduced roles. That's what they're counting on, right? This is what creates cost savings within the system. So when you think about, right, reducing roles, reducing the number of people who have Medi-Cal coverage, what does that mean for local jurisdictions? What does that mean for service provisions? And I think our FQHCs are the ones bracing for the buckle. This is about not being able, right, to get reimbursed for the services that they are going to provide to our communities in greatest need. So that's one way that you can sort of think about it. The other aspect is thinking about people with, right, different immigration or migrant statuses and the way in which we will no longer be able to provide coverage. And that, again, is sort of as a result of, but also as a result of federal policy, but also as a result of our economic position as a state, right? So I think that we have to know these realities in order to be able to shape the research in such a way that relevant findings can be deployed. And sometimes the best way to figure that out is to talk to somebody.
And then I would just add to that, Ryan White. I see an increased burden on Ryan White. Many of the folks who were able to get insurance under the ACA, get coverage prior to that were being covered by Ryan White. And so that there's increased impacts there, as well as potentially shifts to the funding for Ryan White is just the other sort of place to look in terms of how the whole availability of services and who might be affected is going to play out.
Yeah, that's really, really helpful thoughts and responses. And it brings up something else for me, which is uh the really dynamic nature of this context. So, it's one thing to know what the law is when you embark on your implementation study. It's another thing to actually keep track of the changes that were so evident in both of your examples over time, that these are absolutely not static aspects in any way, shape, or form, and are very much interacting with other dimensions, like you mentioned, the outer context, Nina, and of course there's all the interactions with the inner context and everything else that we would be paying attention to. And I'm wondering if you have thoughts on how do we, and this may be a very simple question, but um, what are ways in which we can sort of monitor and be aware of changes? I know you mentioned phone a friend, Ayako, and I think that's very advice where very well taken. Are there other practical, pragmatic ways of kind of keeping track of what's happening with laws and policies that might be impacting what you're doing in implementation, either really in a very explicit way or maybe in a more subtle way. Um, it's just not something that I think we have a whole, I could be a lack in my own knowledge, but it's not something that, maybe we've spelled out as much as would be helpful
Yeah.
as a field.
I intended to look for this, but I didn't. But, IS has so many great tools, these Google Forms or Excel spreadsheets that have sort of been set up to track changes in intervention design or different aspects of implementation. I don't know that I'm aware of exactly a tool like that that could sort of month by
Great
month
point.
help document this, but it
Mhm.
seems easy to create and maybe it is out there. If somebody knows, perhaps share it in the chat. I mean, I was thinking about this just recently because, our community partner was talking about how their work got derailed briefly because of the SNAP, the shifts in SNAP benefits. And suddenly a lot of their day-to-day work was being shifted to helping people at their houses make sure they had alternate ways to get food. And I actually hadn't known that because I actually had thought at first that they provide the food for everybody in their houses, but they didn't anywhere on. So, it's just I agree that I think that's very important, and to have a nice little tool like that to keep track would be helpful.
Mhm.
But I'm not sure if there's one that already exists.
I don't know of one. So I think what you're referring to, correct me if I'm wrong, are, we can track adaptations to our interventions, and we often use the frame tool for that. We can track adaptations to our strategies, and we use the frame
Mhm.
IS often as a tool, and there are other tools, lists and so forth, other tools for tracking adaptations to our strategies as well. But I am not familiar, and others in the audience may be, so please feel free to share. But I'm not aware of a tool that really I love that idea, Dinah. I think it's genius. That would be, and it may exist. So if folks know that something like that's out there, definitely
Yeah,
add to our knowledge, please.
Ayako just shared a link to a legislation tracker in the
Oh,
chat.
nice.
Yeah, so I
Yeah.
think that there are definitely experts around the country, particularly folks that are PhD JDs, right, that have this particular expertise in tracking legislation at the state level, at the local level, at the federal level, related to specific issues. And the problem here is that there's so many. How do we even begin to cover them all? Nina's example, you're talking about, SNAP benefits. We could be talking about housing. We could be talking about Medi-Cal, we could be, and every state is different, right? Remember that system of federalism. So we have local laws, we have state laws, and federal laws. And so how these things get sort of hammered out for where you are, where your research is located, it can be really challenging. I won't lie about it. Every other day, I'm an expert in something different. In part, not because I'm an expert, but because I have to figure stuff out in order to understand how to make right research as useful as possible. So one of the things that we've done through our Policy Research Center is create a legislation tracker. Simplify things. Here in the state of California, we have a Democratic supermajority. There's a lot of law that gets passed through our legislature and signed by our executive. When we track sort of on an by session, right, the bills that are coming through the state, you can see in a snapshot version what is happening in the state of California as it relates to HIV, STIs, viral hepatitis, and overdose. That's just one way in which we're trying to do this piece of educating folks who you may not be, day to day dealing with policy issues at all, but maybe you want to figure out what is happening currently. And that's one way. But
Yeah.
absolutely, point well taken. This is a difficult question, and the solution is probably more complicated than we think.
Yeah.
Yeah, just to piggyback on the complexity and then dynamic nature of policy research, I really think we will need some like theories, models, frameworks to guide the policy implementation science research. So I wonder if Ayako or Nana can talk about like how is there any like a commonly used theoretical frameworks, any recommendation in how to select them in your research design?
I mean, I guess this maybe not be a completely satisfactory answer, but whenever I think about the implementation science frameworks, I kind of look at them and I look at do the sort of variables that are collected on a standard way, do they capture the key things that, I'm starting out with as we must or need or are important? And and do they actually include data that I have or don't have, right?
Mm.
Because sometimes there are things that like there's just no way we're going to get these data. So maybe I need to look to a different type of framework. So, I mean, in some ways, regardless of what type of question, whether it's a policy question or another type of implementation science question, those are the types of things that I'm thinking about. But I feel like the article, because it sort of defines these different ways we might be thinking about policy in our research and then gives like specific frameworks for each of those or gives examples of specific frameworks for each of those, I think that's a great place to start.
Great.
Thank you so much, both. We saw two hands rising. Could you please share your question in the Q&A feature? Thank you. And then while we're waiting for more questions to coming in, I'm just so in the registration, a lot of questions are about like funding opportunities for policy research. Yeah, any resources that you can share, especially for like emerging investigator who want to take the career path in policy research.
Yeah, I think you had actually pulled together some links that people can look to. Um, and then for emerging folks, I would always encourage people to, along with, looking outside to NIH and to foundations. NIH's, interest in implementation sciences keeps growing, and there's more and more funding and focus on that, which is, I know part of why you all are doing this work. But I would also encourage people to look internally because there are often, smaller pots of money for intramural funding and that um, uh, groups like CHIPS and CFAR sometimes really work hard just to get enough people to apply for. So, I would encourage people to look there as well. And then I think you had some resources you were going to share.
I will say that funders are increasingly interested in the question, so what? Actually just heard that on a call recently. And I actually really like that question. The so what question really speaks to this, like, what does this answer give you? What does it tell you? Where do you go with this answer, right? I mean, assuming you arrive at an answer after using your research question to do research, right? I do think that funders are increasingly interested in that. And I think that you cannot deny the importance that policy has, right, in that regard, because implementation is going to rely on this framework. And what that framework is something that you must know before trying to move forward with implementation. So that would be my pitch. This is a critical component of research, and sort of the future of research is going to demand that our projects are geared towards being useful and informing our conditions now and in the future. And for that to happen, we have to be thinking about that question.
Thank you so much. I think we have time for one more question that came up in the Q&A that might be helpful for several folks in the audience, which is, if you are an early stage investigator, what kinds of training would you need or benefit from to become a strong policy implementation scientist?
I'm liking this question. I feel like I have not thought about this enough. But I would suggest some things to consider would be like some economics classes and looking to, if you have a policy school in your institution, looking to some coursework there, not just limiting your kind of perspective to what might be offered in your public school, public health, or your more medical fields, which are, of course, are also going to be important. But I would definitely consider like having that grounding in political science or in economics, depending on your interests, might be really helpful. But I'd love to hear what Allison, your thoughts are, and Chunqing, what your thoughts are on this.
It's a
Yeah,
great
I
question.
think just generally as a previous K awardee, I can only offer my experience. The success of applying for K is like you have to ground in your current training background and then finding your like ultimate goal and then yeah just building step by step progress like toward that goal, right? Say for example like my current my well, training background is in epidemiology and my K in implementation science. So I just demonstrate like how what gaps is in there, and then what kind of like a training courses resources I have to help me to eventually reach that goal. Yeah, that's okay. And then just briefly, I shared the funding. Nina, you mentioned there's a like a um funding database provided by UCLA. It's a constantly updated a funding data source. You can search. It's not like policy specific, but you can search by title, by funding amount, by agency, by due date. So yeah, it's evolving so that you, for I think it's very useful for emerging investigators to find their first funding alternative to NIH ones.
Thank you, Chunqing.
Can I add just a few more? It's my
Yeah.
bias here, Alison, but you know, every project there's a policy angle no matter what.
Yeah.
You know, you don't have to look even too deeply to know that there's a policy angle in every project. And so I challenge folks to find it. And if you ever have any trouble, and you don't have a friend to phone me. I'm open to chatting just about anything and everything under the sun policy, because I think that it's fairly simple if you begin your search early to find people who may be working on your issue, or to find people who are interested in hearing about what you've found, and how that might be relevant to work that they're doing. So this is really something that I think that we can cultivate in this community, in the research community, and you will find experts. I promise you, they're out there working every day. The second piece I want to say, just as you know, a real not a warning, but just a reminder, perhaps, is that talking about policy is not necessarily being political. And I know there's a lot of fears around being political right now, but I think that there are ways in which, and there are spaces where there's still opportunities to bring science to bear on policy making in ways that frame, right, wellness goals, improved HIV outcomes, as non-political statements of our interests, of our collective interests. So I do want to put that out there because I think it's important to remember.
Absolutely.
Thank you so much. It's a great note to wrap up on. Nina, did you want to add to that?
Just affirming what she said.
Yeah, definitely. Well, as always, these beachside chats go very, very quickly. I wish we had another hour to get into more things. If you could just pop us back into the slides quickly, Enrique, that would be appreciated. And we can get to the references one, I think is the one we could start on.
And maybe I will just add that I feel like the other benefit, we talk about engaging stakeholders and then we talk about dissemination. I feel like the other benefit of engaging stakeholders early is that you already have built in some automatic dissemination. They were part of the process of creating this. They will feel more motivated to share it. You're sharing it with some of the key people you would want to share it with anyway. But their networks and hopefully become, venues for that much more easily than if you hadn't engaged them from the beginning.
Absolutely. Thank you so much. So here are just a small handful of references that are pretty central to HIV and other forms of policy relevant implementation research, some practical tools here, some sort of calls for exactly what you were saying, Ayako, like finding the policy relevance in every project and making sure that you're paying attention to that. So just a handful of references here. And then we will ask you on the next slide, please, to join us in evaluating today's session. This is very important information for us to keep these going. And then on the last slide, or well, let me give that a minute for folks to scan the code, the QR code for the evaluation. It's very short. I think it'll take you less than a minute. And then we can go to our last slide, which has another QR code to join our listserv. If you want to be notified of future events, you can also contact us via email. And all of our Beachside chats and methods workshops are available on YouTube. So if you want to go back there or send this to someone else, it should be posted pretty soon. We hope you'll join our listserv. I think we have 10 events so far scheduled for 2026, a combination of beachside chats and workshops, and we really hope that they will be of interest to you and that you will join us in those. So I just want to close by thanking Nina and Ayako so much for today's session. It was absolutely fascinating. I learned so much and it's so relevant to what we're doing in this field. So we really are very grateful to you and honored that you were agreeable to doing this with us. Your work is amazing and we learned so much from it and from you both, and just really appreciate your time and energy and insights. And thank you, Chunqing, for co-hosting with me, and to Wen and Enrique for making all of this happen so seamlessly. So thank you, everyone. Have a great rest of your Friday and a great weekend. And thank you so much for joining us. Take care.
Thank
Bye.
you.